Well, okay, balloon sinuplasty is just one method that we use in performing endoscopic sinus surgery. Endoscopic sinus surgery is something we only do for patients who have chronic sinus disease that has failed to respond to conventional sinusitis treatments like antibiotics, steroids, saltwater rinses, and allergy treatments and things like that. There are some unusual forms of sinus pathology that sometimes will respond to nothing other than sinus surgery. So the conventional or old, it's not really that old-fashioned method of doing sinus surgery is to enter the nose through the nostril using an endoscope and use very small instruments to trim open or cut open the natural opening to the sinus. Balloon sinuplasty is a method where rather than cutting open the sinus, we're trying to just simply dilate open the natural drainage point of the sinus. The hope is that in doing so, we'll create less scar tissue, that the procedure will be less painful for the patient, and that we can preserve more of the normal tissue that's in the sinus rather than cutting through tissue to get to the sinuses. So the way the procedure is done is that we seek out the natural opening to the sinus endoscopically or using an X-ray machine in the operating room, and we put a guide wire into the opening, put a balloon over the guide wire, and inflate it, and it will dilate open the sinus opening and allow us to then irrigate and wash the sinus out and hopefully leave a more open drainage point for the sinus long term. So generally when a patient needs to be referred to the ENT office, it's because they've already been treated by their primary care doctor, perhaps for sinus headaches, for recurrent sinus infections or tonsillitis, but the problem is persistent, or the symptoms are of a severity, enough of a severity, that they're seeking more aggressive treatment. Otolaryngology really is a surgical specialty. We treat a lot of people non-surgically, but the whole purpose of treatment is to screen out who needs surgery and who doesn't, and to apply what we've been trained to do surgically.